Neograft hair transplant is a revolutionary new hair restoration procedure that offers a safe and efficient way to restore natural-looking hair. This minimally invasive procedure uses the latest advances in medical technology to provide a permanent solution to hair loss. The Neograft method has only been available for the past 5 years, but doctors have already carried out more than 100,000 successful surgeries with it. And this number is increasing by thousands with each passing day. Hi, I'm János from HairPalace Hair Clinic, and as a patient coordinator I have accompanied the treatment of more than 1,500 patients in the past 5 years. Today I will tell you everything you need to know about the Neograft hair transplant method, including the reason behind its large popularity among patients. With a Neograft hair transplant, patients can enjoy fuller hair growth with minimal scarring and no linear incisions. This process is minimally invasive and does not require any linear incisions, resulting in minimal scarring and postoperative discomfort. Neograft is a hair transplant procedure that is based on the follicular unit extraction, or FUE, method. This means that the surgeons harvest hair follicles one by one and then implant them to the affected areas. FUE-based methods are minimally invasive with no stitches or linear scarring, allowing quicker recovery and a more natural-looking result. In addition, the Neograft technique employs a semi-automatic device that uses suction to remove the grafts from the scalp. This speeds up the extraction part of the surgery. Neograft is a safe and effective procedure that offers a permanent solution to hair loss. It is ideal for those who want to restore their hairline, fill in bald spots, and achieve a natural-looking result. The procedure is performed by the trained professional, and the recovery time is typically short. Those who are interested in hair restoration should consult with a board-certified physician to determine if Neograft is the right procedure for them. The procedure is very effective at restoring hair in areas of the scalp that have thinning or baldness. Because it is minimally invasive, it is often preferred over more traditional hair transplantation methods, such as the strip harvesting method. The effectiveness of Neograft hair transplantation depends on a variety of factors, including the skill of the surgeon and the health of the patient's donor area. Generally, the procedure has a high success rate, with the majority of patients seeing a full restoration of hair in the recipient area. Patients can also expect minimal scarring and a shorter recovery time compared to other hair transplantation techniques. Overall, Neograft hair transplantation is a safe and highly effective way to restore hair in thinning or bald areas of the scalp. You might be wondering, what is a Neograft procedure like? Well, you can expect to spend anywhere from 4 to 8 hours in the surgery room. Before the surgery begins, your hair will be cut short to allow the surgeon to have a better view of your follicles. Once the haircut is finished, your surgeon will inject your donor area with local anesthetic. This might cause a slight discomfort at first, but it ensures that the rest of the procedure is completely painless. Then the surgeon will begin the extraction. This is done by using a device that utilizes pneumonic pressure to extract the hair. This is followed by another round of anesthesia. Then your surgeon will carefully implant each follicle to create a natural hairline. After implantation, your surgeon may use a bandage to help manage any bleeding. Because a Neograft hair transplant is a minimally invasive technique, it promises a speedy recovery. You can return to your everyday hair care routine in just a few weeks. Candidates should be in good overall health, have realistic expectation for the results, and not to be pregnant or breastfeeding. In addition to physical qualifications, it is important to have a positive attitude as well. Additionally, you must have enough determination to follow through with all the postoperative procedure instructions. The Neograft hair transplant is a minimally invasive procedure, but it does require a commitment to follow-up care. Candidates should be prepared to take any medications that are prescribed and attend follow-up visits as directed by their physician. With the right attitude and commitment, a Neograft hair transplant can be an ideal solution for those who suffer from hair loss. Neograft hair transplants offer several benefits over traditional methods. However, more research is needed to come to a definitive conclusion about its efficacy. One of the most time-consuming aspects of standard FUE is manually extracting the grafts one by one. As Neograft automates the extraction process of the surgery, the procedure takes slightly less time than normal FUE. There are claims that the Neograft hair transplant method provides additional protection to your hair follicles during the procedure. The special wand uses suction to harvest the hairs, believed to lower the risk of damaging strands. This type of surgery doesn't require any stitches or staples, which significantly reduces the chance of infection or scarring. Recovery time is also short. It takes only about 7 to 10 days. The surgery may result in a moth-eaten appearance in case of overharvesting. Tiny pinpoint scars will be left across your scalp following the procedure. An inexperienced surgeon may implant hairs at the wrong angle or create an uneven hairline, leading to less than ideal results. Additionally, Neograft isn't a perfect machine and it may malfunction. FUT is far cheaper than a Neograft hair transplant, but unlike Neograft, it leads to visible scarring on the donor area. This can limit your hairstyle options after the treatment quite a lot. Neograft is based on the FUE technique. The main difference is that in standard FUE surgery, both the extraction and the implantation part is done manually. When it comes to Neograft surgery, the special Neograft device allows for the automation of certain tasks during the surgery. The price of any hair transplant method can vary greatly from clinic to clinic. Things such as the experience of your surgeon, the reputation of the clinic, and the cost of living all play a role in determining the price of treatments. Neograft procedures are by far the most expensive type of surgery available on the market. This is largely due to the high cost of investment needed from a clinic to even acquire such a device. And even if they do, there is a learning curve surgeons must go through before they can master the use of this device. For these reasons, you can expect to pay as much as £15,000, but even the cheapest Neograft procedure will cost at least £4,000 to £5,000. One of the main advantages of Neograft surgery is the quick and painless recovery. As it is one of the least invasive hair transplant methods, it promises a quicker recovery than FUT. According to the inventors of the Neograft procedure, venous treatment, patients can recover in just a single week. Although you should keep in mind that you will have to follow certain aftercare instructions even after the first week. Neograft hair transplant is a safe and effective way to restore natural-looking hair. The procedure offers minimal scarring and postoperative discomfort and can provide excellent results in just one session. While it is based on cutting-edge technology, it is also much more expensive than normal FUE surgery. Although the semi-automated nature of the surgery offers certain benefits, the implantation part matches that of the traditional FUE hair transplants. Thus, the results of a Neograft hair transplant and standard FUE surgery are nearly identical. So would you pay more to get a Neograft hair transplant over an FUE procedure? Let us know in the comments below. And if you enjoyed this video, subscribe to our channel. We post new videos every week, so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.